team. Welcome to Train of 4 training. I have Luke here who has so graciously offered to help me. He wants to make his debut in being famous. And
Here we go.
So we're going to be talking about Train of 4 today. So these patients that we're going to be using the Train of 4 on, they're the patients who are requiring paralytics. So that's going to be our full arrests who are cooling, patients who are in status epilepticus. It can also be used on patients with increased intracranial pressures. Those are probably most likely the patients that we would see who we would need to paralyze. But also we would use it for patients who are fighting the ventilator. They have their muscles, they're using up way too much oxygen through the cooling process, or with infections such as COVID-19. So they are finding that they are using it more on COVID patients who are intubated. So that is why we are going to review Train of 4 and what patients we are going to be using that on. I want to remind you that on patients who are paralyzed, the paralytic does not affect sensation or level of consciousness. So they could be experiencing pain, and they also might be well aware that they are paralyzed. So we never, ever, ever want to paralyze without either using a sedative or an analgesic, or a combination of both. We never, ever want to paralyze first, and we never want to paralyze without one or both of those. So we are going to go ahead and get started with our Train of 4 training. And there's a couple of sites where we can do the Train of 4 testing. The ulnar nerve, we can test. We want to make sure that we are actually on the nerve and not on the muscle. If we're on the muscle, we'll only see finger twitches. If we're on the nerve, we will have a thumb twitch. The other place is a facial nerve. So we'll place our electrodes. We'll place one on near the tragus of the ear, the other one on the outer canthus of the eye, and then there's a spot on the posterior tibial nerve, which I'm not going to train to that today. I'm just going to train to the ulnar and the facial nerves, and if we needed to, we can use our resources to see how to do the posterior tibial nerve. So when we're going to do the ulnar nerve, first off, we want to have our patient's arm laying flat and rested on a surface. We want to do our Train of 4 before we start a paralytic. So sometimes it's emergent and we're not able to, but if we can, we really want to do this before we start the paralytic. So what we're going to do is first we're going to clean the site. Thankfully, Luke shaves already, so I don't have to shave him. Just kidding. So
Every day.
we're gonna, if needed though, if there's a lot of arm hair, we want to make sure to shave it. If there's a lot of edema, we might want to go to the other side. Maybe the other arm isn't as edematous. Also, if the patient has hemiparalysis, then we want to use clearly the unaffected limb. So if they have had a stroke or something and one side is weak and they have impaired sensation, then we'll use the other side if we're able to get that information. So we're going to place one electrode near the wrist on the ulnar side, and then these just need to be 1 to 2 centimeters apart, so you can just have them right next to each other, running along that ulnar nerve. Our Train of 4 our little machine is in the med room. We have 2 of them in the bottom drawer of the med room, and it is labeled, easy to find. So you have your Train of 4 box, then you have our stimulator, then we have our connectors. So the black will always go distal, the red will go proximal. And that is true when we are on the facial nerve as well. So I like to remember it because I think of a red heart, so the red is always closest to our heart. All right, I want to make sure I'm not skipping anything. Okay. So the first thing that we're going to do is we're just going to establish a baseline. This needs to be a tactile stimulus. We need to be able to feel it, not just see it. So what I'm going to do is, if you can zoom in here, our power that is generated from the Train of 4 is over on this side. So as soon as we turn it on, it will light up. So I am at a 1. This is the Train of 4 button. I'm going to push it, and you can hear it. It's pulsing 4 times. There's nothing. So I'm going to hold his hand at the thumb. Nothing. This also is lighting up. I don't know if you can see that. So now I'm up to 3. You feeling that yet?
No.
Okay, we'll go up to 4. There we go. I felt his thumb and his fingers move. So we're at 4. That was a good impulse. So that lets us know that there is a conduction there. And then when we start our paralytic, we'll know how blocked we are with that paralytic based on how many twitches we get. So, but what we want to do, we want to take this a step further, and we want to get the supramaximal threshold. So what that means is the power of the impulse. So right now he's got a pretty strong impulse, but I'm at 4. I'm going to turn it up to 5 and see if that feels stronger than what it was at 4. It felt a little stronger. How'd that feel to you? Now I'm going to go up to 6 and see if 6 is stronger than it was at 5. It felt stronger. I'm sorry, Luke. I'm like torturing him. We won't do the facial nerves today. Now I'm going to go up to 7 and see if it feels any stronger. That felt about the same to me. How'd that feel to you?
Same.
So now I'm going to go back down to 6. And I think that's where our threshold is. So our true threshold is actually a 6 for the Train of 4. So that lets us know that we're getting a consistent impulse to the nerve. And when we're paralyzing, it will help us to identify if we're paralyzing properly. So after we have identified our baseline and our supramaximal threshold, then we are going to start our pain medications and our sedatives, and we'll get our orders for our paralytic and start that. The way that we want to titrate that is going to be based on how many twitches we get. So we turn our paralytic on, and we do our Train of 4, and we get 4 twitches. That means that we are not paralyzed enough. So we're 75% or less paralyzed. So typically we want to be at about a 1 or a 2 on our paralysis. So at a 3 we are 80%, at 2 we are 85%, and at 1 we are 90%. If we get no twitches, then we are way over paralyzed. So this is a really good gauge for us to identify where we want to be. And the physician will have in his order set how many twitches he wants the patient paralyzed to. So that's what we're going to do once we get started. We are going to assess the Train of 4 every 15 minutes after we have started until we reach maximal, or not maximal, optimal Train of 4. Then we will test every 2 hours or every time we change the rate. If we make a rate change, then we're going to assess it every 15 minutes to make sure that we're still within our threshold. And other than that, we will check it every 2 hours. And then we are going to continue to check it once we have discontinued the paralytic. So they should return to baseline within 2 hours of DCing the paralytic. So we want to make sure that we are still checking even once we have stopped the paralytic. And I think those are the main takeaways from the Train of 4. But please review the literature that is in the pass-off. If you have any questions, feel free to come and ask me. I'm not going to make Luke do the facial nerve. I know, he really wanted to do the facial nerve. But just know that if we are having need to troubleshoot, we're not getting any twitches, we're going to want to check our Train of 4 machine, make sure that the batteries are okay, make sure the connections are good, We're also going to check our infusion, make sure that the rate, concentration, everything is good there. And then if needed, we can go to another site. We can go to the facial or the posterior tibial and see if we can elicit some response there. So I think that takes care of just about everything. And go ahead and pass off Train of 4 with your charge nurse. And thanks, Luke.